The three types of hip replacement surgery are total hip replacement, which is by far the most common. Secondly, hip resurfacing, which is indicated generally in younger active males. And the third type, partial hip replacement or hip resurfacing, indicated in the elderly that have suffered a neck of femur fracture. They are all major surgeries, but all have excellent results. Hip replacement surgery is indicated in those patients that have severe hip pain, limited activities of daily living, and severe dysfunction that has failed, that has not responded to non-operative management. The first is total hip replacement, in which both the acetabulum and femoral head are excised and replaced with a prosthetic joint. This is by far the most common type of hip replacement surgery and is performed approximately 50,000 times a year across Australia. The second type of hip replacement surgery is hip resurfacing, which is much less commonly performed. It involves resurfacing the femoral head and acetabulum with a metal prosthesis and is usually indicated in young, active, large males. The third type of hip replacement surgery is partial hip replacement or hemiarthroplasty. This is where the femoral head is replaced with a prosthesis. This is generally reserved for elderly patients who have suffered a neck of femur fracture. Although there has been significant advances in technology and medical care to make hip replacement surgery safe, it is still major surgery and there are associated risks.